So that really angered me. I mean, I was relieved that I had this diagnosis, but I was like, I knew all along I had a thyroid condition. Nobody listened to me for, 17 years. Yeah.
Welcome to Let's Talk Thyroid, where we explore different aspects of living a healthy thyroid lifestyle, positively and practically, to help you thrive and not just survive. Join me, Annabelle Bateman, your host, and let's talk thyroid. At least 1 in 8 women have a thyroid condition, and it could be many more than that because many go undiagnosed due to, at least in part, lack of thorough thyroid testing. That is a mission that my guest today, Denise Roguz, who is the co-founder of Thyroid Change, set out to change. Thyroid Change, as you're about to hear more about that, as well as Denise's own personal thyroid story, is a collaborative network, health information website and social media campaign. The goal of Thyroid Change platform is to unite an international community of medical professionals and patients under the same innovative vision, which is that patients need personalised thyroid healthcare for optimal wellness. I love Denise's tenacity, her big picture vision, which was not just about getting herself the help she needed, but actually getting patients all around the world the help that they need. So please join me as I chat now with Denise about her thyroid story, advocating for thyroid health and thyroid change. Hi, Denise, and welcome to the Let's Talk Thyroid podcast.
Hi, Annabelle. Thanks for having me here.
That's my pleasure. I feel like the last week and this week, I've connected with you and Dr. Johnny Labe, who I spoke to last week, sort of randomly on the internet. So I feel like this is a really lovely way. I'm just feeling like I'm randomly finding the right people. That's obviously not very random, but I feel like I'm finding the right people to talk to at the right time. So it's lovely to actually meet you in via Zoom, and looking forward to having this conversation about all of what you have brought to the thyroid support world globally. Really looking forward to picking your brains and finding out all about you.
Thanks. Likewise, too. It was fun meeting you as well. Like, it was serendipity, I guess. So
yeah, absolutely. We were meant to meet. So we'll get into Thyroid Change, which is your mission, I suppose, in detail in a minute. But can you just give us a brief introduction of who is Denise? How did you become passionate about thyroid?
Sure. Okay, who is Denise? Well, Denise was a struggling thyroid patient that didn't know she had a thyroid condition, or at least it was never diagnosed. I actually knew in my heart of hearts that I did have a thyroid condition because it ran in my family. Every woman on my mother's side had a thyroid condition. So, I mean, my sister, my mother, grandmother, cousins, the aunt, every single one had a thyroid condition. So, I mean, I was kind of on the lookout for it. I knew what it was about a bit. I knew some basic symptoms, but, I wasn't overweight. And I remember complaining to the doctor about being cold all the time. I'm just freezing all the time. And, depression, anxiety. I was a little fatigued, but it didn't really stand out to me at the time. This was way back, in my teenage and, when I was in my 20s too. Right. I was a struggling thyroid patient that just got worse and worse. I thought I had a thyroid condition, but every doctor told me, well, you're not overweight and your TSH is normal. So I thought,
so okay, you're fine. You don't have a thyroid problem.
Yeah. You shouldn't question the doctor or, he's a doctor. He's the expert, or he or she's the expert. So we move on. And I didn't really I couldn't attribute some of the strange symptoms I was having. And then fast forward to, I'm approaching 40. I'm maybe 38 years old or so. And things have gotten really bad. I'm struggling with fatigue. I can't get out of bed. I can't get off the couch. Hair is falling out, losing the eyebrows, the outer edges of my eyebrows, to a lot of anxiety, depression. And I was going from doctor to doctor to doctor, endocrinologist, rheumatologist. Nobody can figure it out. Your thyroid's fine. TSH is normal. So it wasn't until about, 2012, I finally saw a doctor in my town, my city at the time, in Memphis, Tennessee, when I was living there. And he was like one of these out of the box thinkers, the one doctor in town that you go to where, if you really want to try to uncover something, you should go to him. And he was an integrative doctor, and he was fantastic, actually. And I remember him saying, I don't even need to run full labs because I'm 100% positive you have a thyroid condition based on your symptoms. And he did. He ran the full labs, and sure enough, free T3 was in the gutter, free T4 was in the gutter. I had a reverse T3 issue. So that really angered me. I mean, I was relieved that I had this diagnosis, but I was like, I knew all along I had a thyroid condition. Nobody listened to me for,
how many years? 17, oh my gosh, 17 years.
Right. Yeah. And it just got worse and worse. So it was just like, are you kidding me? I don't know. Maybe it's in my personality too. I'm a little bit tenacious. I don't know. Part of it was maybe I was so sick at the time too. I was also out of work, where I was like, okay, well, I'm very sick. I'm not getting better. I was on a bunch of Facebook thyroid help groups, and I met another woman there, and I noticed that she was also very angry. And she was like, I can't believe I'm feeling this much better. She was on Synthroid her entire life. She had Hashimoto's and she was like 10. So she didn't really know what normal felt like. She was just put on Synthroid and that was it. And she stayed on Synthroid until, she had, I think, her first pregnancy. And that's when things kind of fell apart in her thyroid hormone picture. And then her doctor put her on Armour thyroid, natural desiccated thyroid. And she said it was a world of difference for her. And so she was like, all these years, for her, another 20 years, same type of story. She didn't know what normal felt like. All of her symptoms that she had remaining on T4 only medication was just, ignored. And she was upset. And her name was Michelle, and she created a petition at the time. And I reached out to her and we refined the petition. We rewrote it together. We researched a bunch of different medical mandating organizations all over the world, and we sent it out to them.
Wow. See, you were angry women on a mission.
So, and we didn't really expect anything of it. We never talked about creating something called Thyroid Change. We never talked about creating a website. It just kind of took off.
So what was the petition about? Like, what were you petitioning?
Well, we were petitioning endocrinology organizations pretty much, or mandating medical organizations that determine the reference ranges for diagnosing thyroid disease and for treating thyroid disease. So, the standard is, or the gold standard is, any hypothyroid patient, you give them T4 medication, and most patients should do well with that. And the gold standard for testing is TSH only, where that was done to us as well, where we never even knew there was a thyroid panel that you could test to get the whole picture. So that's what we were petitioning and trying to request in this
trying to get that change for thyroid patients. Yeah. So how did the petition go?
Well, it sort of took off. It was shared with a bunch of different health Facebook groups and thyroid Facebook groups, and people got behind this, and we were kind of amazed ourselves. And we were also posting in different groups and such. And suddenly we had people reaching out to us saying, other doctors that said, yeah, we believe in this. We stand behind you in this. We agree 100%. If you need anyone to back you on this, we'll do that for you. We had some B-list celebrities reach out to us as well, and over Twitter and Facebook, and it just took off. And this was at the time when social media, I think, was really starting to explode too, and people were really passing things around and forming like pages for a cause.
Yeah. And so this was back, how long ago was this, Denise?
That was about 2012. So it seemed like it was about the time when people were really creating pages for businesses or causes and things instead of like personal pages. I mean, I'm sure there were others, but it seemed like it exploded around that time.
And so what happened next?
Well, after these people started reaching out to us and we didn't have anything to store this information on, we also were finding the research to support this as well, articles and videos and published research. We said, well, we need a website for this. We need a place to store this information. And that's when Thyroid Change was formed.
Yeah. So that's been going for 8 years.
Yeah,
about that,
more or less. Mm-hmm.
Yeah, and so what's happened in that 8 years? Like what change have you seen in that time?
If there has been change in the medical field, but
do you see that there has been? Well, that's probably a better question to start with. Do you think there has been change in the medical approach to thyroid?
Yes and no. I think it has changed in that I think people are, and even a standard allopathic medicine has become more open to integrative medicine. And that's something that we've always advocated, is taking more of an integrative approach to thyroid care. So I believe that they are becoming more open to that. And it seems like more and more doctors are interested in learning more about integrative medicine rather than just, treating with a Band-Aid. So yes, I think it's changed in that regard. I also think that social media has changed a lot of things. So, everybody's on Instagram now, and they can find this health information a little more easily than I think 8 years ago. As far as the mandating medical organizations, there's some work to be done there. We've written numerous letters to the American Thyroid Association and such, and once it seemed like we had a following, and other people were contacting the ATA after some of the initiatives that we started. We noticed they began having these topics at their conferences regarding, well, should we expand testing beyond TSH? There was more like open dialogue at some of their conferences. But as of today, I don't think with the American Thyroid Association, nothing has changed yet in the guidelines.
So does that mean then that US practitioners, the gold standard still is the TSH? So that's still the base for most family doctors. You would go in and say, I think I have a thyroid problem. They would just test TSH.
Yes. But I think because of social media and because of some, other conferences maybe they've gone to, I think they are becoming more open to it. And it just seems like the awareness has gotten larger.
Yeah. I would say, just anecdotally, I don't know exactly what the official things are, but I'm pretty sure it's the same here in Australia.
Mm-hmm.
That's the standard, and you've got we've got quite different healthcare systems, but our government health would pay for the TSH, but if you wanted the T3 versus T3, T4 and your thyroid antibodies, you would have to pay for that until you would. But once you're diagnosed, then they'll pay for it for review.
Oh, okay. That's interesting. So that's all out of pocket. TSH is the only one that was covered for a routine screening for thyroid. Yeah. But then once you have it, then it will be covered?
Correct.
The full panel?
Yeah.
Oh, interesting.
Yeah.
Okay.
So it's taken me a while to figure that. I was diagnosed at 23, and so I've never had trouble getting all those tests. Like they've always been fairly standard tests for me. And when I can't remember back then what they tested, but I mean, my TSH was 185 when I was diagnosed. So
it just doesn't make sense to me. So the TSH is used for screening, and that's the only one. But once you're diagnosed, then they'll open it up to the other lab tests.
Yeah, I don't understand.
Yeah.
Earlier in the year, I took a thyroid course run by Dr. Denises.
Yes, I've heard about that one.
Yeah.
I heard it's great.
It's an excellent course, and he talks a lot about the screening in that, and that really the base level he says should be the antibodies, and then if the antibodies show up, then look at the other one. Like if you had to just pick,
right?
Obviously, the ideal is to do all of them, but because he's saying that the research shows that the antibodies can show as elevated for up to 7 years before the TSH actually is impacted.
You know, what's interesting, mine was the opposite. My sister had Hashimoto's. I don't know if I don't think my mom was actually screened for Hashimoto's. She just was hypothyroid. So the only one in my family that I know has it besides my cousin is my sister. And so I always suspected, and I always had my regular autoimmune antibodies, the ANA antibodies came up a little elevated, but they couldn't figure out why. But then I was diagnosed hypothyroid. And it was about maybe, probably 7 years later that the antibodies finally showed up. So I was one of those patients that was antibody negative in the tests, and then it showed up later, like years down the road.
Well, we're also individual, aren't we? And
yeah.
I noticed that's one of the things that is your Thyroid Change sort of mission, is to really promote individualized thyroid care for patients.
Absolutely. Yeah. I think you've probably encountered that too with your podcast and your audience, that what works for one person doesn't work for the other. And whether it's diet or medication or supplements, and how their disease progresses, or, I've seen a lot of people in our audience even say, oh, well, you have a TSH of 15. You must feel horrible. And a patient that has a TSH of 2 can still can even feel worse, depending, it can manifest in so many different ways, and in level and in how many symptoms they have too, the intensity and how many.
Absolutely. Yeah. I'm always amazed at that. It seems such individual variation, and yet there are some things that seem to be fairly common issues. Like food triggers, common, not exactly the same for everyone. Stress seems to affect pretty much all of us. So to me, it seems like there are some core, lifestyle things that we can do to help, but yeah, everyone has a completely individual journey, and need to be working with practitioners that know and can help them dig and find the root cause, and find, as you were saying before, the right type of treatment. I think I've tried all the different thyroid treatment medications over the years, and I'm still on the basic, we don't call it Synthroid here, but the basic, T4. I've tried T3, I've tried desiccated, I've tried compounded T4, T3. I've tried it all over the years, but I think that's great that I've been able to, I've had a doctor that's been prepared to try the different, just try different things and see how they work. And for me, I'm back on the standard one because it seems to work the best for me, all things considered. Doesn't mean it's fabulous, but it's...
Have you tried the more bioavailable Tirosint, the liquid cap?
I haven't actually. No, I haven't tried that.
I don't know if it's available in Australia. I know it's very expensive here in the United States, but there's a Tirosint Direct program where you can apply for it, and basically anybody can get it, and it's a discounted rate on Tirosint. So
the first I heard about that was when I did Dr. Karatsian's course. So I'll have to chat, but feel like it is available here. I feel like I've seen that in one of the groups, but I'm not 100% sure.
Yeah.
So that access to different kinds of medication is something that Thyroid Change does a bit of education around. Is that right?
Access. Oh yeah, absolutely. We're not in favor of one over the other. I mean, there are plenty of people that feel fantastic on T4 only. My mom is one of them. She can run around in circles around me. Well, before her back surgery, but that's a different story. But no, she was feeling great on T4. And, for years I told her, well, maybe, you might have a couple lingering symptoms. I was kind of suspicious, but she's like, I feel great. She has a lot of energy. So she didn't want to, tamper or rock the boat with trying something else. And she said she feels great on T4. I know a lot of people do, but a lot of people don't too. And I was one of those people too.
So what have you found that works well for you?
My story became a little more complicated later too. I ended up finding out I have Lyme disease.
Uh-huh.
So that muddied the waters a bit as far as determining which symptoms were which, because a lot of thyroid symptoms overlap with Lyme symptoms. So what I found out was, that doctor in Memphis, Tennessee, he put me on Armour thyroid right away, natural desiccated thyroid. And I felt better. I saw improvements, but I was still not quite right. It didn't seem like I was converting T3 to T4. I was having some reverse T3 issues. I still felt not so great, even though I had some improvements. And that's around that time, that's when I ended up finding out I had Lyme disease. So having this chronic infection was definitely taking a toll on my body and how my thyroid functions and how it converts T3 to T4. So I tried, like you, I tried a lot of different things over the years, different doses. I went on to Nature Thyroid and NP Thyroid. And at one point I was doing T4 only too. And then we added in T3. I did the compounded too. So right now I'm back on compounded T4 and T3, and we're tweaking those doses. And that seems to be the best for me right now. So that's what's working.
Yeah, for now. And that's so much of the journey, isn't it? In 3 years, it might be something totally different.
Yeah. And that's what my doctor told me too. My doctor who treats my Lyme disease and thyroid, he's pretty knowledgeable with thyroid. He told me that thyroid's going to be a moving target for you as we're, tackling this infection and everything else that goes along with Lyme disease. It will be a moving target and there'll be a lot of adjustments. So
with Thyroid Change, what do you see that the role of now for Thyroid Change? Like where are you headed? What are you focusing in on? How can our listeners find out, get involved? Tell us a bit more about what's going on with that.
Well, as far as advocacy is just, strength and momentum and strength and unity. Our goal from the beginning was, let's unite the thyroid community together so that we have a bigger stance and a stronger voice regarding what we want to express from the patient viewpoint. We're not doctors. I'm not a doctor. I'm just taking the information that I learned over the years and the information from the people that reached out to me and trying to create a voice for that. And we have the platform. We have the audience. My goal and my mission now is, okay, what can I do with this voice? I have a voice. There are people listening. There are people who want to share and who want to advocate and to help other people too. So it's really simple. The mission and my goal is to continue that voice, to unite people for change, to transform people's lives, to get them on the road to better health through the information that we share, to form a community of support and helping us through some not so pleasant days.
You've got a lot of really great information on your website, some really good foundational information. So I think for people that are listening, particularly if you're new in this thyroid journey, not quite sure if you've got a thyroid issue or not, I was having a good look, and there's a lot of really helpful information about, even what is the thyroid and how does it work and what are the different options for testing and interpreting those results and treatments. You've got some really great information on there.
Yeah, there's some information too. I think our Find a Doctor page is our most visited page too. So I know we're a little lacking in the number of doctors that were listed in there for Australia, but it's a patient recommended page. We don't screen the doctors, but it's I can't call them all up and say, hey, do you test all of these things? So it's based on an honor system. And what we say on the page is if you're submitting a doctor, they must do these things, and running a full thyroid panel. And we describe what that is, and offering treatment options beyond T4 only, since we're also individual. So we have a pretty big list going there, and that's our most visited page. And I think the testing page, which lists some of the essential thyroid labs and other essential labs that go along with thyroid care, that would be helpful, and some optimal ranges. Optimal ranges not created by us, but optimal ranges that the integrative doctors that we found that specialize in thyroid, what they consider optimal.
Actually, I thought you had quite a few Australian doctors. I didn't look at the other countries to see how it compared, but I thought, I'll have to submit my doctor to your list. She's very good. But I thought you did have, at least you had some, and I thought that was pretty good. So if you are in Australia and looking for a doctor, head there and have a look. And please,
Australian listeners, if you have a great doctor, put them on the site.
Yeah, and I know we've got quite a lot of US listeners too. So again, a great resource. So, Denise, with all your experience, and you've got, spoken to, I'm sure, hundreds or thousands of, people with thyroid issues. So I think, whilst you're not a doctor, I'm not a doctor, we both have been in this space and lived with these issues for quite some time. What would you say to the person that was like you, I guess, pretty sure they had a thyroid issue, but their doctor keeps telling them they don't? What do they do? Where do they go?
Yeah, that's a tough one, because I was in that boat too, and you probably were as well. So without the information, how do you get somebody to get help, right? So if they suspect a thyroid issue, our advice, or my advice too, would be to keep digging. There is information out there. Get a second opinion, get a third opinion. Sometimes it takes several doctors to maybe uncover something and to listen to you. So for me, it took like 20 doctors in 3 different states.
Oh my gosh.
But
over a 20-year period or a 7.
We're going to say that was the past, and maybe that was, yesteryear, and maybe things have changed. But, keep digging. And I would say, try to find an integrative doctor, even though, at least in the United States here, they're often out of pocket because insurance won't cover, the extensive appointment that's often involved.
They're still more expensive here too. We'd have some covered, but again, they are more expensive.
I'm just saying it's a world of difference. It really is. I totally advocate in integrative care. I will never go to a regular GP for my conditions that I have ever again. It's been totally enlightening. So if it's a little bit more money, or even if it is, a strain on the wallet each month, I would say it's worth it. It's so worth it, because if you don't have your health, you don't have anything. And I think we all know that. That would be my advice. If your doctor is not open and you're sure something's wrong, maybe it's related to thyroid, I would say seek an integrative doctor, or look up full thyroid panel online and see what we come up with. Yeah.
I think I noticed on your website, there are private testing labs. I know I've got links to one on mine. I've seen them on yours. You can just order own
That's
blood
right.
tests and then take them. Then you've got to find someone
Absolutely.
knowledgeable to help you interpret them. But you can, at least those services do exist now.
Yeah, that's the key. And that's sort of my next step with Thyroid Change too is, we have these lab services, right? You still need someone to interpret them and prescribe something if you need medications. So, and a lot of patients still don't have access to a good doctor in their town. They might live in a very small town, or it's too far for them to drive. They can't get there for whatever reason. So my next goal is to find online care for patients internationally, and that they can actually prescribe internationally too.
Yeah.
So we have in the United States, we have SteadyMD here. It's an online company that I partnered with, and they're expanding their integrative section. And I actually met with one of their doctors there. He's in my state too. And they were fantastic. I mean, they were everything and more compared to all the other integrative doctors I've been to over the years. They were right up there with them. So I would highly recommend them too. And hopefully we'll get some other practitioners on board that can do international treatment online.
I wonder if with COVID and so many things going to telehealth, whether that this year might just open up more options for
I'm hoping
remote patients, because we've got a lot of people again in Australia that live in regional towns where they smaller numbers of practitioners, no integrative doctors. I've got one lady in my thyroid community, she lives in northern Queensland. I think she's got an appointment with an integrative doctor a good few hours drive away, but she couldn't get until March.
Oh, wow. Yeah.
Yeah.
That too. I'm hoping so. I think the issue is the licensing and everything. I know with SteadyMD, every one of their doctors, in order to treat in the United States, they have to be licensed in every single state. So that's what they're working on their end. So with every new doctor they have on board, they have to get a license. That's what they told me.
Yeah, right. That's
no wonder it's maybe
taking some time. Yeah.
Yeah.
Yeah, but for those, that are listening that, if you are, thinking that you've got a thyroid issue, it's not diagnosed, do go to Thyroid Change and have a look at there is a page there, and I'll put a link in the show notes. That's probably the simplest thing, direct link, because it says, look for these things in a doctor, ask these questions, take this printout. And so I guess that's part of advocating for yourself, isn't it? And sometimes it's harder to do. We know in our head that we need to do that, but sitting in the doctor's office, it can be harder to do that.
Yeah, on that Find a Doctor page too, there's the listings of patient-recommended doctors. But still, if you can't find one near you too, we have some helpful tips on what you should look for in your search. So, for instance, you could Google your city or state and type in free T3. And you'll be surprised at how many different medical practices or integrative doctors' offices will have a blog about thyroid conditions and that they're testing a full panel. So you may be able to find a doctor that way too.
And so for people that maybe know they have a thyroid problem, maybe they know they've got Hashimoto's or Graves', either one, but they're told just take this medication, or I guess in the case of Graves', my understanding is, we might need to remove your thyroid or give you some radioactive treatment. This is just the standard model of care. What's your advice to that person?
My advice is just to fire your doctor.
Yeah. I was waiting for that.
Basically that's where pretty much where it comes down to. Yeah. And I mean, if you know that there are symptoms that are unresolved, you have a thyroid condition and they're blowing you off, try to find a new doctor and to look for those integrative doctors. I wish I would have found my integrative doctor years ago, because I thought that the person that would be the expert in this would be the endocrinologist. And that's where I was focusing most of my attention. And sadly, at least in the United States here, it seems the endocrinologists are focused a lot on diabetes, and really their breadth of thyroid conditions, I mean, I don't want to insult them so much in that way, but honestly, it was the integrative doctors that were more thorough, and knew the ins and outs of thyroid conversion and, other conditions that could be contributing to a thyroid condition, like infections.
Yeah, I mean, just again, anecdotally, in the Australian-based thyroid groups that I'm part of, it would be very similar. You hear the odd name of someone that's recommended as an endocrinologist, but most of us would say, I mean, I haven't seen one since I went to one when I was pregnant with one of my kids because things went a bit haywire. And I felt even back then it was, this is all a bit boring. The focus was thyroid was all a bit, it shouldn't have been. I mean, really, when you think about it, thyroid's incredibly complex and it could be really quite fascinating, I would think. But it's not the impression I got from.
Yeah, it seems like they took a very simplified approach, gold standard testing, gold standard treatment, and that was it. And there didn't seem like a lot of wiggle room for people who were outliers, like me. But it turns out after I found out that there are millions of outliers.
Yeah, I mean, I think, look, I saw an endocrinologist when I was first diagnosed, and I think, 23 years ago, maybe the information was different. There was a lot less, perhaps, access. The whole integrative medicine probably didn't, I'm not saying it didn't exist at all, but it wasn't really a thing. So I think, all right, well, 23 years ago, I was told, just take the medication, you'll be right, off you go. But when I hear people still being told that makes me angry too. I think, really? Like, it's, how can that be? So that's why, Thyroid Change, you're doing such a fabulous job, because I think the more of us as patients become aware, and I think that's part of my heart with the podcast, is just spreading awareness of what is a thyroid condition, how can it manifest, could you have one? I feel like every second person I'm talking to, I'm saying, I know maybe I'm seeing thyroid everywhere, but have you had your thyroid tested? It could be this, could be that. Yeah, it could be, but it could be your thyroid, and at least you can rule that out.
Yeah, you probably have diagnosed a lot of people you've known too, or diagnosed, right? You can sniff a thyroid condition a mile away. Yeah. I'm guessing you're the same way.
Yeah, and so it's hard to say, like, am I just seeing it in everyone? Or, is it that case? But, when this year my mum was diagnosed with Hashimoto's after years of, like, I don't think it could be thyroid, and she'd had the standard, the TSH is fine. And I said, Mum, you've got to get your thyroid antibody levels tested. Please just go and just insist. Yep, Hashimoto's. And I thought I was not like you. I haven't had no one else. I thought I was this genetic anomaly in my family. I'm the only one that's had it. I've had it forever. And now, well, no. But there's been a lot of other inflammatory things. The women in my family have other inflammatory issues. And so I'm like, I think you should, I said to my sister, next time you get some blood tests, maybe throw in a thyroid antibody panel just to check it out.
That's interesting. But she had a thyroid condition and she knew about, but didn't realize she had Hashimoto's.
No, she didn't know that she had a thyroid condition.
At all. Okay.
She had the TSH tested over the years, but it had always been kind of okay, not necessarily optimal, but kind of okay. And so I think it's just that maybe me just banging on about it a bit more and her not feeling right and just trying to dig, so just keep digging, Mum, just keep digging. On a similar note too, I had a doctor in my quest for trying to get a diagnosis and figure out what's wrong with me. I remember one doctor telling me, because your TSH is normal, it was like a 2, because your TSH is normal, we don't need to test your antibodies. So, of course, that's not true. But yeah, that's just sort of even the misinformation that's going around, that's out there too, even with doctors. So what can we as the average thyroid patient do to bring about thyroid change and thyroid advocacy? What can the normal everyday thyroid patient do?
And I'm seeing it a lot on social media and even on Instagram too. It seems that a lot of people are passionate about sharing. So that's what I keep telling our audience too, is just to keep sharing. And if they suspect somebody with symptoms that they can't explain, or they're going in circles with their health too, with fatigue and depression, anxiety. I mean, I feel like even with depression, that should be screened. A thyroid condition should be screened no matter what. That's actually how my sister was diagnosed. She had a savvy psychiatrist that knew about thyroid, and she had some mild symptoms, but it was mainly, she was complaining of depression. And sure enough, it was a thyroid condition. I would say to not be shy about expressing what you've learned over the years. I felt like I've been that way too, where I've always kind of kept things back. I am naturally a little bit of a shy person, but since learning what I've learned, I've managed to diagnose of a few people in my inner circle of friends and family too. So my advice always is to keep sharing your voice and your experiences, and eventually we'll get heard.
And we've all got a different story. And that's one of the things I often say to my guests, that there's normal, everyday people sharing their thyroid story on the podcast. And I think I really love it when they do, because it does take courage to talk about your health and your journey. And I mean, I'm pretty open about it. I've been on social media for a long time talking about it. It is not such a, I suppose it just feels like that's part of who I am. But I know it's not the case for a lot of people. And when we're talking about complex histories over often many years, it can be hard to articulate it. So I have great respect for those that have come on the show to share their story. And I often say to them before we record, there'll be at least one person that needs to hear your story. Even if it's just one person, that your story is slightly different to mine. If all I did was share my story, people would get bored, because my story isn't going to touch everybody's story. But your story, Denise, is a little bit different. And so people listening today, there'll be something that you've said that will be a trigger or an encouragement
absolutely.
Totally agree. The more that we talk and share, then the more that gets that.
Right. And one in eight women have a thyroid condition. And that's what's according to the research with the ATA. So I would argue that it's probably more than that, because there are so many people who go into undiagnosed and who don't know that they have a thyroid condition, because, only TSH is being tested. So makes you wonder, how many are there really? If one in eight is known in the research, is it 1 in 5, 1 in 4?
It's just crazy. Even that 1 in 8 stats is mind blowing when you think about that. So if you're listening, keep testing, keep checking out, keep reading, keep digging, keep speaking out. Yeah. So to wrap it up, Denise, I asked most of my guests this: if you could go back, to Denise before you were, you knew you had a thyroid issue, what would be your top 3 tips to yourself? What would you go back and say?
Oh, before I knew I had a thyroid issue, or before I was diagnosed?
Well, either way, just if you could go back in time to wherever you choose, what would be some, your 3 top tips?
Okay, I'll go back to, I'll start with, if I could go back in time to the Denise that maybe wasn't having symptoms yet, but maybe was about to. I would tell that person, I would tell Denise to relax a little, because I remember even then getting worried about things too easily. And I would tell that young Denise that to be tenacious about all of her symptoms as they are about to, come about. And to the Denise that was struggling to find a doctor in that period of time where I knew something was wrong, I knew I had a thyroid condition. I did. I would tell her that she should have found an integrative doctor first. I think I would have saved a lot of time, time and pain if I found that doctor first. But I didn't know. I really didn't know. I didn't know what an integrative doctor was.
And that's part of the journey, isn't it? Maybe we find things at the time ultimately we're meant to find. And so it's almost an unfair question I ask, but because we can't really go back.
Yeah, but maybe it will help somebody else out there. So,
correct. And pretty much everyone I've asked that has said one of their 3 things has been along the lines of relax more. Don't get so stressed. Yeah.
I've been doing, I'm just going to throw this out there because it's been helping me. I've been doing dynamic neural retraining system, DNRS. So it's basically like retraining your brain to go to think about things that aren't negative or to carve new pathways. And it's really interesting and it's helping a lot. And I think it's a great thing to integrate for any like treatment program that you're on. I know a lot of even Lyme patients are using this to incorporate with their treatment plan to help them get out of a sick patient mode into like a healthy, positive, forward thinking mode. And, it's kind of amazing. I'm surprised at the improvements I've seen so far. So,
is that a particular program that you're doing?
I am. Yeah, that's what it's called. DNRS, Dynamic Neural Retraining System. And there's some other programs that are similar. I think it's the Gupta program, and there's another one I can't remember. But I'll throw that out there to any of your listeners too, because I think it's a great adjunct therapy for your mind to get you out of a sick patient mode and you can focus on the future. And it's more than just like, oh, you just have to think positive. It's more than that. It's pathways in your brain that are like deeply carved on how you think and you associate. It's like creating different associations.
Yeah, excellent. Oh, I'll check that out because I think that mindset aspect is really fascinating. And I had a neurologist on the show recently, and he was saying how important that is too, that, you know, that you can change your neural pathways. Don't ever think that you're stuck and that you can't change, but you totally can. If people want to connect with you, Denise, where do you want them to go? How do you want them to connect or follow or?
Sure. I think the best way is to direct them to the website. We're at ThyroidChange.org. And if anyone wants to reach out to me personally, they can send an email to info@ThyroidChange.org too. We're also on social media. Facebook and Instagram are our 2 most common.
Excellent. Well, and I'll put all the links to those in the show notes so people can click on them easily. But I want to thank you for being the voice, being a really large voice in the thyroid community worldwide, and, you know, having that tenacity and determination to push for change, to push for advocacy, and just playing, the part that obviously you've been meant to play in this bigger thyroid global. Sorry, I love the way that you've just thought big about it from the beginning. So thank you.
Oh, thanks. You too. Absolutely. I'm so impressed with everything you're doing. So good for you.
Did you know that one of the things that I offer is a free 30-minute strategy session? So if you want the opportunity to sit down with me, talk about your health goals and make a plan, create some action steps, or just talk things through with someone who gets it, then more than happy for you to book in for a strategy session. I'll put the link to that in the show notes. Send me a message and I'd love to connect with you. Thank you so much for listening to this episode of Let's Talk Thyroid. I would love it if you would subscribe to the podcast and share it with others that you know with thyroid problems. Let's get the message out there. If you'd like to connect with me further, the best place to do that is via my website, annabellebateman.com. From there, you'll be able to join my Facebook group, book a strategy session with me, download my freebie, and access any show notes for this episode. Thank you so much, and I'll see you next time. Bye.
The information presented and discussed in this podcast is not intended to diagnose, treat, cure, or prevent any disease and should not be used as a substitute for proper advice from a qualified professional.